Hello, this is Michael Traub. I'm going to be speaking at the 2017 SIBO and the SIBO Conference and Professional Forum, which will take place at the National University of Health Sciences on March 25th and 26th, 2017 in Lombard, Illinois. And I'm going to give you a little preview today on my presentation. The gut-skin axis is a plausible model for the association of GI disorders with skin diseases. And in my presentation in this forum in March, I'll be discussing the existing evidence basis with regard to rosacea and acne, atopic dermatitis, psoriasis, urticaria, systemic sclerosis, and skin cancer. And in my presentation, I'll be describing how dysregulation of the innate immune response as a result of GI inflammation in systemic cytokines and microbial antigens and antibodies in the skin, contributing to skin disease in genetically susceptible persons. I'll tell you how the treatment of SIBO can be integrated with other evidence-based approaches to treatment of skin conditions. So some examples that I will be, of the topics that I will be discussing are, first of all, acne. Over 75 years ago, dermatologists first proposed a GI mechanism for the overlap between depression, anxiety, and skin conditions such as acne. And they hypothesized that emotional states might alter the normal intestinal microflora and increase intestinal permeability and contribute to systemic inflammation. Among the remedies that they advocated were lactobacillus acidophilus cultures, and many aspects of the gut, brain, skin unifying theory have recently been validated. The ability of the gut microbiota and oral probiotics to influence systemic inflammation and oxidative stress, glycemic control, tissue lipid content, and even mood itself may have important implications in acne. The next subject that I'll discuss is rosacea. And I'm going to be sharing my presentation with Dr. Leonard Weinstock, a gastroenterologist who has expertise in SIBO. And Dr. Weinstock and 4 Danish authors published a paper a few months ago in August of 2016 in the British Journal of Dermatology. Then they described this robust analysis of data from the Danish Health Registry that provides evidence that SIBO and other GI disorders can contribute to rosacea. There were associations drawn with nearly 50,000 patients with rosacea, and 2 studies have been published that have shown that treatment of SIBO can improve rosacea. Then we have atopic dermatitis, and recent advances in the understanding of this condition have paved the way for the development of new strategies for the prevention and treatment of atopic dermatitis. Among the new therapeutic options, there's increasing interest in the potential benefit of probiotic supplementation. It's been widely demonstrated that the human microbiota plays a fundamental role not only in the maintenance of intestinal homeostasis through the interaction between microorganisms and the innate immune system, but also in the microbiota-mediated development of adaptive immunity. A considerable body of literature has been published analyzing the effects of probiotics on atopic dermatitis patients. And in order to shed light on frequently conflicting results, in my presentation I'll share a state-of-the-art assessment of the most important studies looking at the role of probiotics both in the prevention and treatment of atopic dermatitis. Lastly, scleroderma, or systemic sclerosis, is an autoimmune disorder that can affect multiple organ systems, and GI problems are the most common complications. These include gastroesophageal reflux disease, SIBO, and chronic intestinal pseudo-obstruction that is secondary to extensive fibrosis that can lead to nutritional deficiencies in these patients. In my presentation, I'll be discussing the pathophysiology of systemic sclerosis, the progression of GI manifestations and secondary malnutrition, and the use of oral and parenteral nutrition to reverse severe nutritional deficiencies. Increased mortality in patients with concurrent malnutrition in systemic sclerosis, as well as the refractory nature of this malnutrition to pharmacologic therapies, kind of compels us to provide novel and more effective interventions in reversing these nutritional deficiencies. So oral and parenteral nutrition have important implications for patients who are severely malnourished or have compromised GI function, as they are relatively safe and have substantial evidence of success. So I look forward to discussing these subjects with you in more detail in March of next year. Hope to see you there. Thank you.